Hello and welcome to another episode of A Slice of Health, the Candid Health Chat podcast, where we slice away health truth from health fiction. Join me and my friends as we challenge common health myths via chit chat, powered by several cups of coffee. Don't forget to subscribe and follow us on social media, and do visit us at asliceofhealth.club. Let's get to today's episode. Welcome back to A Slice of Health, where health comes alive, with bite-sized health education to keep you moving and become your own health champion, with stories that heal and knowledge that empowers. But before we jump into our topic for today, I want to tell you a story. Lola, a 34-year-old woman, has always had bad periods. As long as she can remember, since she started having her menstruation at the age of 10, she has always had cramps. Every month often found her laying in bed, missing school as a teenager, and even in her early 20s, through university and going into the working environment, she noticed that compared to a lot of her friends and colleagues, she always needed time away to recuperate due to the pain that she was experiencing. As she got into her later 20s and into her early 30s, she noticed that the pain was getting more excruciating and debilitating. She found that she was unable to go to events because of her period, unable to go to work, missing increasing number of days due to the extent of the pain. As she got older, she also noticed that vomiting had become part and parcel of her symptoms. She would vomit before the period and often during the first few days of her period. The pain also started causing her to need to use hot water bottles, which started scarring her lower tummy with something called erythema ab ignae. Lola, because she had been told that this was normal, because she had been told that this happened to all the women in her family, accepted this as normal. And although she tried different tablets, medications, sometimes pills from the doctor to try to regulate her cycle, none of this seemed to help. Eventually, Lola said to her friend what had been going on, and her friend said to her, "This is not normal." Lola said, "Well, this is what I've always experienced. For over 2 decades, I have lived in pain." But her friend told her, "Because it's common to you does not make it normal." And so Lola took that to her doctor with a different approach. As opposed to saying this was normal for me, she said, "I hear other people do not experience this. Something must be wrong with me." Her doctor referred her to a gynecologist who organized an ultrasound scan and an MRI, and Lola was diagnosed with stage 3 endometriosis, making her a candidate for a new drug called Ryco. So, what exactly does all of this mean for Lola, who has been missing work, missing school, who has found that 30 to 50 days of the year finds her laying in a bed, unable to stand straight because of the amount of pain that she experiences? Endometriosis affects about 10% of women who are of reproductive age all around the world. The WHO classifies it as a chronic disease associated with severe, life-impacting pain during periods, sexual intercourse, bowel movements. It's also a condition that can cause other symptoms like bloating, nausea, fatigue. And a lot of these can be associated with depression, anxiety, and unfortunately, infertility. Currently, there's no treatment that is a full cure for endometriosis. All the attempts to manage symptoms are about symptom control. So what exactly is endometriosis? It is a disease that causes tissue that seems to be similar to the lining of the uterus to grow outside of the uterus. On biopsy, It looks similar to what we call endometrial tissue, that is the lining of the uterus, but it is not exactly like it. This endometriosis tissue is actually a lot more aggressive, and it can form adhesions, which are basically a thick stickiness within the pelvis, around the ovaries, and also around the bladder and the bowel. In some women, this endometrial tissue has also been found outside of the pelvis. Endometriosis, unfortunately, is a complex disease, and it can affect many women right from their first period, regardless of their ethnic origin or social status. So as you can imagine, a lot of women around the world are living in constant pain. What happens with these endometrial cells is that they spread quite aggressively and continue to reproduce. Like in Lola's situation, it can have a significant impact on a person's quality of life due to the amount of pain that it causes, due to the amount of time that is lost due to work and school being missed. It can also affect a person's emotional life due to painful sex that it can cause, leading to avoidance in affected individuals. So how do we address endometriosis? And what are the treatment options for Lola? Because unfortunately there's no treatment that can cure the disease at present, the first line is normally pain medication to try to reduce the inflammation associated with the endometrial tissue. Hormonal medications as well can sometimes help, and these are often in two categories. The first, birth control, which tries to regularize the fluctuations of hormones, because there's some evidence that suggests that endometriosis and estrogen have a high correlation. Another treatment is something that can cause a blockage in the normal flow of hormones. These are called GnRH analogs. A new treatment called Ryco has been approved by the FDA and also in the United Kingdom for women like Lola who have severe endometriosis on diagnosis and who are also affected by their symptoms. Ryco is a 2-in-1 treatment that causes a stimulation of the menopause, so it reduces the estrogen level significantly. And then the second is that it has add back estrogen in it at a baseline level that is better able to manage endometriosis symptoms while a woman doesn't feel like she's going through the menopause in terms of the symptoms that she receives as a result of the blockage, as well as the other concerns with early menopause, such as osteoporosis and heart disease. Surgery can sometimes also be used to remove those adhesions and scars that I mentioned earlier. However, in a lot of women, they find that this abates their symptoms for a short period of time. However, because it's not a cure, endometriosis tissue can grow again. Some women have had drastic means of treatment to see if their symptoms get better, like removing their womb. However, because endometriosis tissue is not exactly endometrial tissue, some women have found that even after their womb has been taken out, they still have endometriosis in new locations in the pelvis. So what should Lola do? One of the first things that Lola needs to do is speak with a doctor that has the ability to think about her healthcare in a holistic manner. This means thinking about her diet, exercise, the impact of endometriosis on her bowels and bladder, as well as the impact of endometriosis on her emotional well-being, her partners, and her sexual life. She would also need to have conversations about family planning and also about managing her energy levels because of the fatigue that is known to be associated with endometriosis. So there we have it. Endometriosis is a complex disease. It is chronic and it can have an impact on every aspect of a woman's life, including her emotional wellness, her romantic life, fertility and pregnancy, her ability to go to the toilet, to pass urine, or open her bowels. So we would encourage Lola to take one day at a time and have a conversation with her doctor about what it is that she wants to do right now in an attempt to make her symptoms better. So there you have it from me, a case of Lola, a case that's very dear to my heart. Until I come back to you in your ear tomorrow with stories that heal and knowledge that empowers. Bye for now. Thank you for joining us on today's episode. Remember that this podcast in no way replaces the advice you receive from your own doctor or physician. Don't forget to subscribe and follow us on social media. Leave us a review on iTunes so that others can access the amazing content. And don't forget to be a health champion wherever you are by separating health fact from health fiction.